Hi, everybody. My name is Pena, and I'll be delivering my capstone project today that is titled The Heart Grew 3 Sizes, Improving the Health Literacy of Patients Utilizing a 3D Heart Model of Hypoplastic Left Heart Syndrome. That is a mouthful, so we'll be referring to that as HLHS. So first, I want to acknowledge the main contributors to this project and who has supported me throughout this whole past 2 semesters. Dr. Michael D. Maria, who was my mentor throughout the project and who allowed me to work with the single ventricle clinic at Children's Hospital. Dr. Daniel Zablah, who assisted me with creating the 3D heart model. Dr. Kaylee Yor for being my advisor, and Dr. Senor Salcedo for being our capstone professor, and also the Modern Human Anatomy program and class of 2021 for going on with this journey with me. So I first want to talk about the anatomy of hypoplastic left heart syndrome and really understanding what it even is. And so HLHS is going to be a congenital heart disease, which will be a disease that is going to be occurring before birth. And so with HLHS, we see that there is approximately 1,025 neonates that are born with HLHS every year approximately. And so also with HLHS, the main deformity is going to be an underdevelopment of the left side of the heart. And so this deformity of the left side of the heart is including anatomical differences that involve as I pull up a laser pointer, that include the left ventricle that will be underdeveloped, a mitral valve that will be underdeveloped, and also the aortic valve. Then we also see a narrowed aorta for a lot of the patients. And then finally, we see a atrial septal defect. And so going along with these anatomical differences, we see specific symptoms in the patients that are affected with this syndrome. And so we see a cyanosis or a bluish skin coloring. And so this cyanosis is due to a mixture of oxygenated and deoxygenated blood that is occurring because of these various anatomical differences within the heart. And so we also see other symptoms such as problems breathing, a weak pulse that are also present. And then the way that we're able to treat hypoplastic left heart syndrome is through a 3-step surgical procedure, which would be a Norwood procedure, a bidirectional Glenn procedure, and a Fontan procedure. We will not be going over these surgeries in detail, but a general gist of it is that these procedures are used to help redirect the circulatory system of the heart. And so the main gap in something that we were trying to tackle was the HLHS patient and family education. And so overall, there is a lack of educational resources to improve the health literacy for parents and patients who are newly diagnosed with HLHS. And so normally the resources that the single ventricle clinic had was using 3D heart models that were created from an MRI of the patient from the cath lab that they had there. And as we see this image on the right, we actually are able to see this 3D heart model that my instructor or that my mentor has. And so this is normally the model that's given and used to educate patients and families. And so this doesn't really give us a clear representation of the anatomy in question. And overall, why should we care about improving educational resources? Well, studies have overall shown that by improving health literacy of parents and patients, we are able to reduce patient anxiety and overall improve patient outcomes. And so for this study, we hypothesized that a 3D printed HLHS heart model will help families to improve their understanding of the diagnosis and the anatomical differences before and after a surgical intervention. And so to do that, we created a 3D heart model from a MRI of a patient with HLHS who was overseen in the single ventricle clinic. And so we see that this model was rendered in SketchUp for final approval and then was sent off to Axial 3D that was then 3D printed. So I'd like to show, let's continue. So continue here. So in order to show the 3D heart model and its entirety of the anatomical structures in question, we have our right and left brachiocephalic veins, our superior vena cava, and then we have our right atrium. We will then have our right ventricle present, our left ventricle here, our left atrium, and then our aorta. And then to show the actual 3D aspect of this model, this is me just kind of showing the model and kind of trolling it around to show that 3D orientation of it all. And so on the 3D, I just want to point this out, on this video, we are actually able to see the aorta that we're able to form during the procedure, and then also a inferior vena cava that is present for the patient's families to witness. Okay. And then we're actually able to open up the heart too to show some of the internal structures that we wanted to point out to the patients and families, and also showing some of the anatomical relationships that we wanted to present. So for this project, some of the methods that we used was using a pre-test survey to evaluate the patients and families' previous understanding of HLHS, and then having a educational intervention that involved a educational discussion of about 3 to 5 minutes while utilizing the 3D heart model during this discussion. And then after that, we then gave them a similar post-test survey that then just once again evaluated if there's any improvement after the intervention. And then finally, using data analysis via Jamovi to analyze the data. And to analyze this data, we had the null hypothesis that there would be no change to the survey score after this educational intervention. And so for our results, we saw that the quiz averages before and after an educational intervention are present. And so this bar here is representing the first quiz attempt before the intervention, and the second one's representing it afterwards. And so we see that there was a slight overall increase in this average score, but the p-value that we received showed that it wasn't significant, and that was most likely due to a smaller sample size present. And another way to evaluate the parents and the patients and seeing how effective this study was, we also gave Likert scale questions. And so each of these colored bars represents a certain Likert scale that was given. And so the main bar I want us to look at is going to be this orange one that is representing that the 3D model helped improve their understanding of HLHS. And overall, we see that there is positive scores and positive agrees that this model did help them understand this overall process of HLHS. Okay. And so some conclusions that we were able to see for the study was that overall, yes, it was not statistically significant. This was most likely due to a small sample size. We are still in the process of collecting more data over the next month. And so evaluating that further with more results. And then also by creating an educational discussion and a 3D model that is tailored towards the families and patients, this is going to help bridge the knowledge gaps. The educational discussion and the survey was created with the help of Dr. DiMaria to understand what they, as a healthcare team, would want their patients and parents to know to have that overall knowledge of HLHS. And then we also see that we have a lack of 3D models or images to represent post-op anatomical changes. In the survey, a lot of the common questions that were missed were about post-op anatomical changes. And so having maybe 3D models that represent post-operation, or even just images or diagrams that are showing these different anatomical changes afterwards. And then some future directions that we would like to take for the study were to be evaluate the subjects based on their demographic. Because of our smaller sample size, it was hard for us to evaluate and really compare their demographic as a whole. So looking at their demographic involving race and ethnicity, possibly their income, their location, and also their educational level. And then also increasing the sample size and just continue to collect data. And then finally, to create 3D models and other diagrams that represent multiple congenital heart diseases. Many of these patients and parents that I worked with talked about how each of their kids were different, like all these patients have different hearts, but being able to show different diagrams and models that are able to include these various congenital heart diseases that are affecting the patient in total. So thank you all for your time. I'm happy to take any questions now.
Excellent work, Deion. Any questions? Nothing so far in the chat. All right, any going once, going twice, any final questions? All right, well, I think we'll move on.
Sorry, real quick, Jennifer had a question on how much does one of those 3D prints cost? So one of these 3D prints was actually made through Dr. James Abla and through the actual 3D company who specialized in creating models to help with healthcare. I wasn't too sure on the actual specific cost, but it was through her research budget that we're able to create those from. So.
All right.